Now, another reason why fat is involved is that, well, lipids in blood. So again, what happens with lipids? Lipids, they don't dissolve freely in blood at a very high concentration. They tend to aggregate. And what happens if pressure starts forcing lipids toward the sides of your vessels? Well, they end up sticking. And what happens if these fats start to accumulate, stick, and grow bigger? Well, that's a normal artery we had here, but when you have lipids starting to deposit on the walls of a blood artery, typically artery, rarely veins, that can happen sometimes, but typically artery. But notice that you have all these lipids, and what happened to the inner diameter of the vessel, or the lumen, we call it. So notice that it went from this big circular healthy looking artery to now it's narrowing. So what's that going to do? Well, think about like traffic. What happens if all lanes of a freeway are open, and then all of a sudden somebody starts to cone off things and make it only so two lanes are open? That starts to, yeah. So you're also squeezing that area, but you're also reducing the flow as well. So that's what we're having here with this lipid deposit. You're increasing pressure, but you're also reducing the flow. What if you reduce the flow completely? Well, if you reduce the flow or narrow it to the point where there's barely any blood trickling in, you get a condition called ischemia. So what is ischemia? So in general, it refers to a reduced blood flow to a tissue. So it's not just for the heart. You can get ischemia anywhere in your body, but again, it just refers to reduced blood flow. And if you have reduced blood flow, that means you're depriving a tissue of oxygen, you're depriving a tissue of glucose and other nutrients, and it's also going to build up waste and also build up things like acids as well and carbon dioxide. So ischemia is harmful to tissues in the long run. So what happens if it's prolonged? Well, if the cells don't have energy and they can't maintain their metabolism and keep themselves healthy, the cells will eventually die. So what does cardiac ischemia result in? So this is what happens here. If you have a complete blockage of a coronary artery, what happens to everything downstream of that? Well, it's like blocking and damming up a river. If you dam up a river, you're not going to get flow to the areas downstream of that river, right? So without any blood going down here to this cardiac tissue, this heart muscle will be damaged, or if this stays untreated, without oxygen or nutrients, these are going to die. And yep, someone's already talking about, so heart is constantly beating. So you can 24/7, your heart is a muscle that works nonstop. And so since it works nonstop, you also need a constant supply of oxygen and nutrients and glucose to supply your heart. And coronary arteries, these are the essential supplies that are essential routes of supplying these nutrients and oxygen. So what if a coronary artery is completely occluded like we see here? This is what we call a myocardial infarction, more commonly known as a heart attack. So myocardial infarction is the medical term for a heart attack, but yeah, they are the same thing. The heart attack is a layman's term. But yeah, angiogenesis we might get to later on. So yeah, myocardial infarction, that's what's happening here when you block off a coronary artery. You starve the downstream tissue of oxygen and nutrients, aka ischemia. If it's prolonged ischemia, all these cells that are downstream end up dying. So again, why? Because it needs the oxygen and nutrients and getting rid of the waste. Now, how do you treat MIs? So interesting thing is that, so cardiac muscle regenerates but very slowly. And as someone pointed out in chat, that your heart actually multiple tissues can secrete these factors, and we call this process angiogenesis. But you can also secrete factors that build new blood vessels, and it's actually a very interesting point of research. Like, the cool thing is that even cancer cells, they kind of use this system and hijack it to make more blood vessels toward the cancer cells. It's very interesting. But yeah, back to cardiac. So things that depends on severity and time. So how much of how further upstream, or if it's like in something that's more further away from the aorta, maybe only a tiny portion of the heart will be affected. But if it's something like like near the base of the aorta and the left coronary artery, that's going to be a wider area. And also depends on the time of the ischemia. Like, were these cardiac muscle cells subjected to a longer period without oxygen, or was it only a brief period? Yeah, so blood thinners, blood thinners, you want to prevent clots because, again, clots can also block vessels as well. So yeah, things like anticoagulants and beta blockers, you want the heart to ease up. So you don't want another clot forming or your heart to work too hard that it forms another occlusion and causes another heart attack. And angioplasty and stents, so we might want to do something that helps to reopen and fix these blood vessels so you restore blood flow to the heart. And coronary bypass is when it's blocked completely, and instead of actually trying to treat the block, you actually graft another vessel so you go around it. So it's kind of like taking a different route. Like, to say there's like a total traffic jam or roadblock and you take another route, that's what coronary bypass is like. And future therapies, so the thing is that your cardiac muscle regenerates, but it's very, very slow. So typically when you have an MI and a heart attack, more of like a certain significant percentage of your heart dies off, and the part that regenerates every year, well, two things affect it. That it's not going to regenerate like 30% of your heart. It's only like maybe 1% at best, 0.5% as you get older. So, and the other thing is that these cardiac muscle that regenerates, it's so slow it's almost negligible. It used to be say like, okay, when cardiac muscle dies, it's dead. There's no regeneration. They did find a small population of cells that do regenerate, but they're very, very small, almost like to the point that they're irrelevant. And this was a famous local entertainer, Don Ho, and probably set off like generations of local musicians in modern Hawaiian music. And it was interesting, back in 2005, so some of you are kids, so he actually went under experimental stem cell procedure in Thailand. And why? Because we were still researching it in the US and we didn't know if it worked or not. It hadn't undergone clinical trials, so this is why he had to go to another country. And unfortunately, I think he had another incident the next year. Like, he was okay for a year, but then I think he ended up dying in 2007, so it probably didn't work. So, but the thing is that it was experimental, and this is it was one of the more promising avenues of regeneration and repairing the heart after a myocardial infarction. But this was a big setback. So this happened in 2018. So there was a Harvard researcher. So again, just because I'm from Harvard doesn't mean that they're better than us. In fact, this guy is the pits. He falsified 31 studies, but not only that, the results of these fake studies were being used in clinical trials. So people around the United States were were getting these experimental therapies that were based on falsified data that didn't work. And I wasn't surprised when all these collaborators who were trying the treatment, they're like, hey, we're not seeing the results you got, Harvard. So what happens is that as more and more people like start trying to start doing these trials across the nation, they're like, we can't replicate your results. We're not getting the results you're seeing, Piero. And that's why it happened in there. Yeah, so he got, I don't know if he got sentenced yet, but yeah, pretty much he's like struck from the record. All his studies have been retracted, and this is a crappy thing. It really set back the whole research field for cardiac stem cells. The good thing is that by him being taken out of the lead, it's kind of like Silicon Valley. Sometimes people jump on the hype train, everyone chases the hype train, but this hype train is like Fire Festival. It was all fake. So this is what this guy did. Yeah, and that's the thing, is like, if you make bold claims, people are going to try to, in science, people are going to try to replicate the results. And if they can't replicate the results, this results in disaster. So yeah, he set back stem cells along, and who knows, maybe Don Ho's treatment, I mean, I wasn't his coroner or examiner, but he might have had, like, unfortunately had a stem cell transplant based on nothing. So yeah, this really set back the field. But the good thing is that there were other people who were less popular and still studying stem cells in other ways, independent of, yeah, Dr. or former Dr. Anversa. I think he still would be doctor because he has the degree, but non-practicing. But the good thing is that this was rediscovered in the last year. Like, okay, it's a low rate but detectable. So, but the thing is that if you lose 30% of your heart, your tissue due to a myocardial infarction, I mean, how many years is that going to take? And not only that, it slows down as you get older. So this is why younger people who experience a heart attack, unfortunately, early on, they bounce back easier than someone who's, say, elderly and 80 years old. Because again, this regeneration, it does happen, but it's a very slow rate.